their life. And nowadays we see more and more people suffering with back pain because of the wrong posture. They sit in for long durations, or not just a desk job or any other job. We are not really taking good care of our backbone, our spinal cord. That is the main reason for this back pain. And if you see this backbone, it is vertical only in human beings, and in all other animals it is horizontal to the ground. And that is the reason why in all the other animals the weight gets distributed uniformly all over the body, whereas in human beings the entire weight gets concentrated in the lower back region because of the vertical posture, and of course in the knees and also the heel region. So unevenly distributed weight is one reason why we get more back pain than any other animal. Okay. And if you look at this backbone, it is not a single bone. Though we call it as a backbone or Reet ki Haddi, it is not a single bone. It is made up of 33 small bones. Okay. So in Telugu, we call it as Vennu Pusa, or it is more like a back bead. This single bone is called a bead. My arrow is visible.
Yes, it is visible.
If you look at this, this is a top view of this backbone, single bone vertebra. We call them as vertebrae. Some 33 vertebrae are there. So if you look at the top, this thing, there is a hole in it. There is a hole in it. And through the hole, the spinal cord goes like, just like, you are making a chain out of beads, and this thread is the dhaga, is the spinal cord. So this entire backbone which you are able to see is made up of 33 bones, 33 individual bones. This blue color, that is the spinal cord which is going through the bones. And on the right side and left side there are around two. On the right side there is one nerve, and left side there is another nerve. So at every joint a pair of nerves come out. In that way, from the neck region till the lower back region, around 31 pairs of nerves, they come out of this spinal cord. They actually supply information from brain to other parts of the body and other parts to brain. It's like they take and they bring and take the information from brain and vice versa. So these are not blood vessels. These are actually nerves. They are like cable wires. And the place at which this wire comes out, this nerve comes out, you can see that there is a disc between this bone and another bone. This particular purple color thing which is there, that is a intervertebral disc. This intervertebral disc is also a part of our skeletal system, but it is not what we say a bone. It is actually a cartilage, and 80% of this 80% of this particular disc is filled with liquid, and because of the presence of this liquid, it is like a cushion, like a spring, like a shock absorber. If you stand for long duration or sit for long duration, or if you bend forward, or if you lift a lot of weight or travel on a jerky road, this bone tends to hit the next bone, and the disc in between acts as a shock absorber. When the bone comes and hits another bone, the disc in between, it sends the bone back to its place. It's like a spring. But when this liquid inside the disc gets reduced because of degeneration, this disc is degenerated, and the spring action or the action of the disc get reduced, and then there is pressure on the disc. It gets compressed and it will not recoil. And if the pressure is more, it sometimes comes out of its place. Like if you put jam in between two breads and press it, the jam comes out. The same way, if you observe this spinal cord which is all through this backbone. So disc, but here if you see, because of pressure, the disc comes out and compresses the spinal cord here, and that causes pain in that particular part of the body. In this, you will be better. There is a pressure on the disc, and the disc comes out, and through the whole the spinal cord goes. Here, the disc presses this spinal cord. Maybe you will see it much better here. See, both the bones are compressing the disc, and disc is coming out, and it is pushing and pressing the spinal cord. That is the reason why we get excruciating pain. This pain is not something we can describe in words. Only those people who experience it, people who have this back pain, they look normal. They look absolutely normal, but actually they experience a lot of pain, and other people will not be able to see why they are having that so much pain. So if there is a pain in the knee, there will be swelling and all, and other people will have that sympathy and empathy. Oh, something is happening. But whereas this back pain, it visibly it looks pretty normal, but the pain will be excruciating. Okay, and then this is the actual picture of the backbone. This particular thing is a bone and another bone, and in between there is the disc, and this disc is getting crushed, and the liquid inside the disc is coming out of its place, and this is a spinal cord, and this disc is pressing the spinal cord, and you are having pain here. So this is what is happening. Then, and this is an MRI. MRI is magnetic resonance imaging, where you will be able to see what is happening in the disc also. So if you look at this particular part, this is the brain, and the continuation of brain is spinal cord. It is going like this throughout your backbone, and here you can see the blue arrow. That blackish thing is the disc which got degenerated, and it came out of its place, and it is pressing the spinal cord, and that is the reason for pain in that particular region. If you look at this particular image, this white color thing is the spinal cord which is going through the backbone, and then these are the discs in between. This is a bone, this is a bone, and this is a intervertebral disc, and this last disc, if you see, that is black in color because the liquid inside it got completely degenerated, and it appears blackish in color, which indicates severe degeneration. And then the disc came out of its place, and it is compressing the spinal cord. So that, if you see, the last disc is coming out because the entire weight is there on the last disc, and it is coming out and compressing the spinal cord, and that is causing the pain. And if you look at this particular picture, all these yellow color things are nerves which are coming out of your backbone. As I told you, there are 31 pairs of nerves. Some nerves, and they come out of the backbone and enter the hands. Some nerves enter the head, some into the eyes, and some come down, and from the lower back region, if you see, some nerves are going till the thigh region, some are going till the calf region, and then to the heel, and even to the fingers of the toes and other things. So these nerves, they are carrying information from brain to enter all the parts of the body. And if you look at this picture, the spinal cord is giving two nerves outside, and one nerve is getting compressed by this disc, and the nerve, wherever it goes, every part of that particular path will be affected. So for example, see, this particular disc is compressing the nerve, and the nerve is going through the leg, and the whole entire part is getting affected. Pain is not just there in the lower back region. The entire hip region, thigh region, calf region, heel region, and even in the fingers, everywhere the pain will go, depending upon which nerve is getting compressed. So the problem is actually in the lower back region, or in the neck region, or in the middle of the backbone, but you will experience pain in so many other parts of the body. So this is called radiating pain actually. See, the same thing happens in the neck region. There is a disc compression, but because of the compression of the nerve which is coming out of the neck region, the entire hand, whole hand, there will be numbness and pain and burning sensation, sometimes in the head, sometimes they experience headache, sometimes nausea, vomiting sensation, sometimes they complain of severe pain in the eye region. Eye. And some of my patients, they say that I have so much pain in my eye that I want to take a knife and remove the eyeball from my, this thing. So that much pain they will experience. And all this is happening because some nerve is getting compressed because of the disc degeneration. So if you look at this particular figure, the first disc is very normal disc. And the next disc is in, there is a degeneration in the disc. The liquid inside the disc got degenerated. And then the next disc, because of the degeneration, because of the pressure, it came out. It is a disc bulge. It came out of its place. And then in the next disc, you will see that the liquid also came out of its place. There is herniation. There is protrusion. Then the space between two bones gets reduced because of the reduction in the liquid and because of the degeneration in the disc. And in advanced stages, you will also see degeneration in the bones. Okay. So this is what is happening in people who experience pain initially. So don't get afraid, madam. This is what is happening in a person with a serious problem of back pain with spondylosis or spondylolisthesis or spondylitis. Maybe in your case, it might not be the case, but initially when you have a problem with your back, it can be only muscle spasm or anything else. But if it is a starting stage of degeneration, and even if the doctor identifies that this is the early stage of lumbar spondylitis or cervical spondylitis or some dorsal spondylitis or some place your disc is getting degenerated, most of the doctors, they say that you have to take bed rest and you take some painkiller if you have severe pain and do some exercise or go to a physiotherapist. Unfortunately, bed rest or painkiller or exercise or physiotherapy will not stop this degenerative process. And this degeneration will go on. And at some point of time, the disc comes out of its place very badly, and the doctor will suggest, now you have to go for surgery. Though it can be prevented completely, somehow we will reach a stage where we have to undergo surgery. So what surgery? So the disc which came out of its place, they might cut that particular part, or they will remove the entire disc, because even if you cut a small part of it which came out of its place, after some time when there is again more pressure, more part of the disc will come out. It is better to remove the entire disc. So what they'll do is they'll remove the disc and put some screws and plates to fix both the bones. And by doing so, you are making these 2-3 bones into a single bone, one bone. And what is the problem with that? Normally, why do we have so many small bone pieces in our backbone instead of having one single bone? So that we will be able to move like this, bend forward, bend backward, like this. All these movements will be enabled by a chain of bones. But when you make them into one single bone, particularly in the lower back region, you will not be able to bend or do like this thing. But many patients, they, in spite of having this problem, they say, okay, even if the movements get restricted, I'm okay with that because I'm having severe pain. I want to get rid of it. I want to go for surgery. Problem here is this particular surgery is very, very complicated surgery. And it's more complicated than opening your brain and doing some surgery inside your brain. Because when you cut the disc, if you cut a nerve accidentally, the patient will be paralyzed for life, or he might lose the sense of touch for life. He might lose the control over his bladder for life, or worse, he might lose his life itself. So there are so many complications with this surgery. Of course, there are very good surgeons who actually do a brilliant job in doing this surgery. But even if the surgeon does this surgery without any complications, still the problem is you are only addressing this particular problem at the level of one or two discs, whereas this degeneration can happen in any part of the body. It's not like we have cartilage only in lower back or neck or some place. No, in entire skeletal system, wherever there is a joint between two bones, there is a cartilage. This particular cartilage is also there in the shoulder, in the elbow, in your knees, in your hips, in your heel. Even between this bone and this bone, if there is a movement, that movement needs some kind of cartilage in between. And once this cartilage gets degenerated, once this degeneration starts in your body, this degeneration can happen at any place, not just in the lower back region. Any part of the body can get degenerated because of this. Of course, we need to understand why this degeneration happens. That is the most important part, because unless we understand why this degeneration happens, we will not be able to understand how to stop it. So if you remove one or two discs, there are so many discs in the backbone. So if you remove one or two discs, the pressure, the lowest, the discs at the lowest part of the body, in the lowest part of the backbone, they will come out of their place because entire pressure is on them. Now you have relieved the pressure on those particular discs. The next disc will take that weight and they will come out. You can't remove each and every disc. You can't remove the cartilage in every place. Like you have the similar degeneration in your knee, then they suggest you to go for total knee replacement or some other hip replacement. So they have replacement surgeries for each and every joint, but isn't it illogical to replace each and every joint which gets degenerated? We need to understand the main reason behind this entire degeneration process inside your skeletal system, because it is not normal. It is actually abnormal to have degeneration at a very young age. This degeneration should start at 60 or 70 normally. But nowadays, we see degeneration at an age group starting from 10. Youngest patient with severe disc problem whom I have treated is 13 years old, 8th standard girl. So why is this happening? We need to understand. So whatever food we eat contains so many micronutrients which are very, very useful for energy production and also tissue building. And our body needs this nutrition continuously. Continuously, we need this nutrition. Continuously, each and every part of the body takes this nourishment and rebuilds its all the tissues and organs and organ systems. But sometimes this nutrition will not reach a particular part of the body because a set of chemical reactions which happen inside our body to distribute these nutrients and to each and every part of the body, these set of chemical reactions get disturbed because of certain free radicals or endotoxins, toxins which get accumulated inside our own body, toxins which we ourselves produce. Now you might ask, why do we produce toxins, and why a particular part of my body is getting undernourished, whereas I am giving the best nourishment possible for my body? So we need to understand what exactly is happening. What is happening? Each and every part of our body needs nourishment, and to get this nourishment, a sort of chemical reaction should happen. And if some sort of free radicals are disturbing these chemical reactions and they are not allowing the nutrients to reach certain parts of the body which are getting degenerated. Why are these not allowing, and why are these endotoxins getting produced inside our own body? What is the reason behind this production of these endotoxins, harmful chemicals inside our own body? We are only producing these free radicals, and why is that? So the reason is our lifestyle. We are not eating in time, we are not sleeping in time, we are not getting up in time. We are, exposing our body to lots and lots of pollution and exposing ourselves to lots and lots of mental disturbances, anger, irritation, tension, mental stress. and of course, smoking, alcohol, and so many harmful medicines themselves will also cause accumulation of free radicals. So many reasons are there behind this degeneration, behind the accumulation of these free radicals. And these free radicals, free because they are circulating all over the body, and radicals because they disturb other chemical reactions. And free radicals are not nothing but ions. People from chemistry, they understand what ions are. They are unstable, chemicals, unstable particles, and they want to get stabilized by disturbing other chemical reactions. So these ions, they get circulated in entire body, and they cause degeneration in whichever place they go. So this is the reason for degeneration in so many parts of the body, not just in the backbone or neck, or in the knee joint, or in the heel or hip, or anywhere degeneration can happen because of these free radicals. Even these free radicals can also disturb the immune system. So then what is the solution for this particular back pain and neck pain without going for any harmful painkillers or dangerous surgeries, or without any recurrence in future? What do we do? Because in our hospital we are treating this such patients with back pain and neck pain from past 16 years. So what we do exactly for patients with serious problem with, they generally come to us when they they get suggested by the doctors to go for surgery. Then they will look for alternatives. But I strongly feel that the moment they identify that they have some kind of degeneration in the initial stage itself, they should come and meet an Ayurvedic food, and take some simple medicine, start some yoga, pranayam. All these things will help in regeneration of the cartilage. But unfortunately, they come to us at a very advanced stage. But still, we strongly suggest, we strongly say that you should not go for surgery at any stage. Some people, they come on a stretcher. People carry them on a stretcher and they directly admit them in our hospital. Even at that stage, we say don't go for surgery, because surgery, most of the time, it is a very complicated surgery, and so many people are getting many complications. Many people come to us after surgery with severe quadriplegia, like entire part below the neck gets paralyzed because of simple neck surgery. So at that stage also, people come, and it is very difficult for us to treat such cases. So initial stages, if you come then with simple medicines and lifestyle modifications, we can easily reverse this regenerative process. But if you are coming in an advanced stage, what we will do is we will do some cleansing therapies like panchakarma, in which vamana karma and virechana karma, they help the patient remove each and every toxin accumulated which got stuck in each and every cell of the body. They will be coming out of these cells, and they will be removed from the entire body. And it's like it is more like there is some virus in your laptop, and you are not able to remove this virus, and the laptop is very, very slow. And what you will do, generally you will format the laptop or desktop, right? In the same way, it's like formatting your entire system. This Vamana and Virechana is completely cleansing and bringing the whole body to the base normal stage. So then, yeah, I will answer questions within 5 minutes. I will complete it, and I will take up all your questions, Mr. Shivadeep Giri. And after this cleansing, cellular detoxification helps in stopping the degeneration. But already there is degeneration in so many discs. So what we will do to regeneration is also very important. So we actually say that regeneration is possible with so many therapies. I am showing pictures of few therapies which are external therapies, which will help in improving the circulation, strengthening the muscles, reducing the pain, increasing the flexibility of joints. But these are all external therapies. But actual regeneration happens with some internal therapies called Kalavasti and Nasya Karma, where we help the body to regenerate the cartilage which already got degenerated, in either it is in the lower back or neck or knee or heels or hip or anywhere. And people ask us, is it possible? Is it possible to regenerate your cartilage? Doctors say, no, it is not possible. This is one kind of preconditioning we have, that our body is more like a particularly our skeletal system is more like an iron frame, and after some time, just like the iron gets rusted, our skeletal system also will get degenerated, and there is no other way than to replace each and every joint which gets degenerated. That is the only way. That is what we think, and we got conditioned by many people, by the society, by even by the doctors, that once your bones get degenerated, you will not be able to regenerate them. That is a wrong notion. But now doctors all over the world, now they know that regeneration is possible. But why did we see? I'm showing you this elephant. Some of you are from Kerala. They might know that they train this elephant in a special way, and the elephant is a very small baby. They will tie this elephant with a particular rope with a specific color and texture, and they train it so well that when the elephant becomes a big elephant, Mada Gaja they say, even if you tie it with huge chains and tie it to a huge tree, it will be able to get free itself by breaking the chain, or just plucking out the tree. But if you tie it with that particular color rope with which it got trained, it will not move an inch, because in its mind it got conditioned, preconditioned, it got fixed, it got tuned, auto-tuned that no, I will not be able to move if someone ties me with this particular rope. In the same way, we got tuned that health is not my responsibility. If something happens to me, I have to go to a doctor, and doctor should solve my problem. And if he suggests you have to remove this particular organ, let him remove, replace it with some artificial joint or something like that. Okay, that is okay, because I have outsourced my health to the doctor. It is not my responsibility to keep myself healthy. So the regeneration is not something I can achieve even if I try. That is what our preconditioning says, but that is not fact. That is not the truth. Now all over the world there are so many regenerative so many research centers working on this regenerative therapy, and from past 5,000 years Ayurveda is telling that regeneration is possible. In fact, Ayurveda compares human body with a flowing river, like a flowing river. So we say that you can't step in the same water twice. The river is there, but water is going away. So once you step into the river and pull your leg back, and again you step into it, the new water is there. In the same way, all our body parts made up of different cells. These cells, they actually take birth, do some work, and they die. This happens continuously. They take birth, do some work, and they die. Every cell has a specific lifetime. For example, the cells on our skin, they live only for 30 days. So they take birth, live for 30 days, do their work, and then they die. In the same way, cells in the stomach wall, in the mucous membrane, the lining, they live only for 5 days. The cells in your blood, you know that the blood cells, they live only for 120 days. That is the reason why you will be able to regenerate your blood even if you donate your blood, because body will make more and more blood cells. And nowadays you know that people are donating liver also. A healthy person with a healthy liver, he donates half of his liver to a person whose entire liver gets damaged, and both of them, they grow their own liver, because these cells, they again and again they take birth. In the same way, each and every part of the body, for example, if you take our skeletal system, the cells in our skeletal system, they live for only 90 days. So within 3 months, all our, if today I have so many cells, skeletal cells in my own body, after 3 months, not even a single cell will stay in my own body. They just disappear, they die. And I'll get more and more new cells. So theoretically, what I'm telling you, what I'm suggesting you is, within a span of 3 months, our entire skeletal system will get replaced, and you will have a brand new skeleton. Then after 3 months, if you take an MRI or X-ray, you will be able to see, you should be able to see a new regenerated disc, but that is not the case. After 3 months, there is more degeneration. Why is it happening? Imagine I like this building very much, and after 40-50 years, I have an attachment with this building, but the building becomes very old, and government says I have to demolish the building. I don't want to demolish the building. Then there is some new technology where I will be able to remove each and every brick and replace it with a very super strong brick. And if I replace all the bricks, now I have a brand new strong building. But what if I replace the old brick with another old weak brick, and I replace all the bricks, but still I have a weak building, much weaker building. In the same way, old cells they die and new cells they get produced by the body, but the raw material to produce these new and strong cells, whether it is a bone or cartilage or any part of the body, we need raw material, and that raw material is food. And the micronutrients are not reaching that particular part, body is not getting because of so many disturbances inside our body, so many disturbances in our metabolism. So we need to create an environment in our own body so that body will heal itself, regenerate itself. We need not replace anything. We should help body regenerate itself. And that is quite possible. Of course, there is one special therapy from the therapies which stop degeneration, and regenerative therapies like Vasti and Nasya Karma, which will start regeneration. There is this special therapy called Vahni Karma, which is again 5,000-year-old therapy suggested by first told to us by Shushrutaracharya, who is the actual father of surgery. This Vahni Karma is transferring thermal energy to that particular part of the disc which came out of its place, so that the disc will go back into its place and it stays there stronger without coming out of its place again and again. And this is a wonderful therapy which we practice in our own hospital, and it's a very, very effective therapy. So this is something which we do for patients with advanced levels of back pain and neck pain and degeneration. So we tell them that this first part, the number one is the therapy which we do. Number two is sleeping in time, eating in time, getting up in time, and eating healthy food which will help in regeneration, and avoiding all the unhealthy food items which will cause degeneration. And the third part is keeping your mind peaceful, because mind, if it is getting disturbed, the self is getting disturbed, indirectly lots and lots of free radicals will get accumulated inside our own body, in each and every cell of the body, and this will cause a lot of degeneration inside the body. So it is very, very important to have a very strong self with self-regulation. Further, we advise prioritizing life, understanding the reality, and then practicing pranayama, meditation, and of course some advanced techniques of meditation and all those things we teach our patients. And of course we all the lower back or neck region, we have some very, very good asanas which I will show you right now. So a combination of all these things, 1, 2 and 3 will, in fact, I can proudly say that many of my patients, they get an MRI after 1 year of the therapy, and if they regularly follow all these 3, they will see that the disc which came out of its place, it goes back in its place and it will be healed completely. So many of my patients in my village where Manoramaji came, so there so many of them are villagers, are like more like farmers and labor. They do a lot of physical labor, and when they get this problem, they go to a surgeon, and the surgeon says that you have to undergo a surgery, and after the surgery you should not even lift a weight of 5 kgs in a entire life, next life. They're afraid of it, though they get this surgery done free of cost in Arogyashree and government schemes, but they don't go for surgery and they come for this Panchakarma therapy. And after the therapy, now many of these farmers, they are lifting 50 kilo rice bags on their back or kheti ka kaam, and then they're putting big huge what we call water pots on this head and moving long distance, and all these things they are doing without any problem. So but this is all one part. This is the part where till now whatever I told you is the treatment which we do. But if it is in an initial stage, all you have to do is give proper nourishment to your body, do some simple exercises and asanas, and do some pranayama, and correct your lifestyle, strengthen yourself. That's all. So these are some food items. For example, all kinds of grains which are growing nearby in your locality. They are all good for your health. Particularly this ragi, this millet is like very rich in calcium. And then we have sesame seeds which are very good for bones. And then there are so many other millets, grains. We should not just depend upon one particular grain like gehu or rice, but we should try all the grains available nearby, and that will give proper nourishment. Eating more and more fruits, taking more and more vegetables, dry fruits like dry khajur and dry dates and dry grapes and badam, anjeer, and akhroat. All these are very good for strengthening our skeletal system. Milk and ghee are also very good. Buttermilk is good for not preserved food. So all these fruits, vegetables, dry fruits, milk, all these things will, and all the grains, all the pulses, all these things will give enough strength to our body. If the body properly utilizes this nutrition, automatically it will help in regeneration of this cartilage. Of course, you need to avoid fried food, spicy food, oily food, reheated items, pickles, potatoes, pumpkin, jackfruit. Potatoes, pumpkin, jackfruit, banana, they cause more pain. That's why we ask them to avoid till the pain comes down. Solid curd, vegetarian food is not very good for regeneration. So jam, sauces, canned food, tinned food, of course, junk food like pizza, burgers, and all other things, particularly foods which are not freshly prepared, or foods which get sprinkled with all these artificial flavor enhancers. All these things are uh, agents of degeneration. They fuel this, they take this degeneration fast forward inside our body, and they will never help us to regain our back. So we need to avoid. Of course, we need to sleep by 10 p.m. and get up before sunrise. It is better to have breakfast before 8, lunch before 1, dinner before 7:30, before the session starts now. Avoid pollution. Try to be in a natural place. Try to breathe fresh air. Doing spinal exercises to strengthen backbone and spinal cord. Regular pranayama and meditation, because pranayama and meditation, they help in regeneration of cartilage and bones. That's proven beyond doubt scientifically that pranayama helps in regeneration. And of course, prioritizing life, which also helps in reducing stress and tension. Avoiding foods grown using pesticides and fertilizers. And this is something which I experience as in my past 16 years experience. When I tell my patients, they say, what is the relation between contributing to the society and getting healed? I can't logically establish this relationship, but I have seen it in my own experience that people who somehow make a difference in others' lives, they easily respond to our treatments and they easily heal themselves. So that is something which I cannot explain scientifically, but that is my experience. Of course, this posture, you all know that wrong posture is the main reason for many problems, not just the back pain or neck pain. So you need to have a proper posture. You can see that all the 4 postures from the left side, they are all bad postures, and only the extreme right posture is correct posture while you are standing. While you are using your mobile phone, using it like this is your maximum damage will happen. If you are using your mobile phone like this, you can just keep it like this for some time, but don't use it for more and more time. It causes so many problems. And of course, when you sit before a desktop or computer, you all know that the monitor should be at your eye level, not like this. You should not look at like this. And the angle between the backbone and the thighs, it can be 90 degrees or more than 90 degrees. Like this you can sit, but you should not sit like this. Okay. And the angle between the thigh and the leg, again, it should be 90 or more than 90. You can put your feet directly on the ground, or you can put on the table footrest, but not inside your chair like this. You should not put them inside. So this is a very wrong posture. Particularly people who work for more time before the system, they should always keep in mind. And every 45 minutes you should look at your posture and correct it, or stand and flex your body once, flex and extend your body once, and then sit back and work. If you have some problem in the back, you have back pain, don't bend directly, don't lift weights directly. You have to sit, bend at your knees and sit and take this thing. Don't directly bend, and you might damage your backbone. Of course, these are all wrong postures. speaking like this and reading in your bed or using your laptop in your bed and all are bad postures. These are some exercises which will help in strengthening your back. This is the best position to start exercises. And this is two varieties of bhujangasana, where you are lifting your back and bending it backwards. Any asana or exercise involving backward bending is very, very good for your backbone, spinal cord. Any asana or exercise involving forward bending like this is bad. Okay, so this bhujangasana, in the first stage you are touching the entire forearm from knee to the hands, palms entirely on the ground, and you are just lifting it forward and looking at the wall before you. And in the second stage, you are just touching your palms on the ground, and you are lifting your entire back part, and you are looking at the ceiling. So two stages of bhujangasana. Here is a shalabhasana, different ways. You are lifting one leg, and then you are lifting other leg, then you lift both the legs, and sometimes you will also lift the head. And in this particular exercise, you are lifting one hand and opposite leg, right hand and left leg, then left hand and right leg along with your head. You are lifting, doing exercise. And this is naukasana. And again, two types, where in one picture you are taking the support of your hands, in the second picture you are not taking any support. And this is dhanurasana. All these are good because you are bending your back backwards and it is strengthening your back. And some neck exercises which we all can do. All the people who sit before computer should do these exercises. They are very, very simple. Like bending your neck like this, then like this. Do like this slowly. If you have severe pain, you have to be careful while doing this. Then you bend like this. You do like this. I am visible, right? My video is also coming, right? I'm just doing the exercise. I don't know whether you are able to see me or not. And then stretching like this. And the next exercise is taking your head forward and backwards like this, then lifting your shoulders like this, then rotation clockwise and anti-clockwise like this. And these are some static exercises where you just press your head like this. You don't go like this. Though you are putting a lot of pressure, you again press your hand with your head, like equal pressures, so that you will not move. And then opposite side, in a similar way, press like this and then press like this, like that you can do. Okay. And there are some other exercises like waist rotation, hip rotation, spinal stretch, and then spinal stretch forward and backwards, not very much forward, torso twist. So these are some exercises which will help in solving this problem. So now I think I have taken almost the entire time. I will take your questions. If needed 10 more minutes, I will take. So thank you for being with me patiently. I think I have given you a simple idea about how to strengthen your back and keep this back pain away from your this thing. So I'll take any question right now.
You can raise your hands, please, if you want to ask any question.
Thank you, doctor, for taking this topic today.
Yeah.
And you have explained everything very well.
Yes.
Some points I know already, but you clear all the points very well.
Yes.
And if there is a jerk during the traveling, that also affects the bone, means spinal cord?
Yeah, many people say that while traveling, there was a jerk, or I have lifted a cylinder or a suitcase, and since then I started getting this back pain like that. Many people say, and that is a trigger. But if there is already degeneration in the spinal cord, if there is already degeneration in any disc, that particular jerk will make the disc come out of its place, and it might help. It might be a trigger for compression of the nerve, but that might not be the sole reason. Maybe already the degeneration is there. So if there is no degeneration and still there is some kind of injury or some pain, it will heal itself. Body will heal itself. All we have to do is do some simple exercises and take bone, and it will, applying oil to the body every day will keep our skeletal system very, very strong. Okay. So, but if there is degeneration already, then we have to be careful. And we have to, if the pain is persisting continuously, the pain is there, or whenever there is some strain, the pain comes out again, it shows up, then you have to take an X-ray or MRI just to rule out this degeneration. If there is degeneration, then you need to definitely consult a doctor and try to regenerate all your skeletal system.
Okay, thank you. Thank you so much.
Namaskar, Dr. Sundaraj. This is Professor Parashar here.
Namaste, sir.
Yeah, sorry I joined late. I just have one or two small points to clear in. You made a mention about this Vamana and Rachna. Am I right? Vamana
Yes.
and Rachna?
Yes.
Was it specifically in connection with the regeneration of cartilage, or was it something which is for the general toning of the body?
Vamana and Virechana is for detoxification, removing these free radicals, endotoxins from each and every cell of the body,
Okay.
which will bring our body back to normal state where it can heal itself.
Okay.
Until and unless these toxins are removed, you will not be able to create that environment inside the body for regeneration.
Oh, I see.
It is more like stopping the degeneration and helping our body to regenerate by bringing it to the back to normal state.
Mhm. So it logically then it may be good even for the general toning of the body. Am I right?
General toning, regeneration, rejuvenation, revitalization, whatever you say, it is more like it can reverse the aging process. People, they say that after undergoing Vamana and Virechana, they look much younger. So it's not just though it cosmetically, you from outside you look beautiful, but it indicates that from inside you are becoming healthier.
I don't know. Maybe it may be a little time consuming. What exactly is this Vamana and Virechana? In just 1 minute, in case you can.
Yes, I can. Vamana is removing these toxins through vomiting therapy.
Okay.
But it is not like stomach wash. You drink some salt water and vomit. No, not like that. It is like cleaning each and every cell of the body. So for that, we prepare the body with some preparation medicines, Deepanpachana medicines, and increase the digestive fire and prepare each and every cell for the entrance of this particular main medicine called Snehapana. And this Snehapana we will give for 3 to 7 days. And this Snehapana, this medicine will enter each and every cell of the body, and it will remove these toxins from each and every cell of the body. And then we do some special therapies to bring them all the toxins from their places to stomach. And then we give some special diet. And then one day after preparing the body for at least 9 to 14 days, we prepare the body, and then we allow the body to remove these toxins by inducing this vomiting. This vomiting actually will happen for 1 hour, 1.5 hours only, but the preparation will be for at least 10 days, minimum 10 days. So it is not a simple stomach wash. It is cleaning each and every cell of the body. That is Vamana. Then Virechana is like removing the toxins from through motions, but still again it is not a purgation, giving a simple purgation medicine to clean only the intestines. It is for cleaning each and every cell of the body. Again, we do the entire process. We prepare the entire body for at least 12 days. Then on the 13th day or 14th day, we will give this Virechana karma. Someone has raised their hands.
Yes, sir. I'm just giving mic. And in chat, Chandrasekhar sir is asking that whether hot water will help in back pain. Hot water bath.
Yeah.
Will help.
Actually, hot water is very good in relaxing all the muscles and tendons, ligaments, strengthening the skeletal system, particularly people with back pain or any pain, hot water bath is very much useful, particularly after applying hot oil to the body and allowing the body to seep in. And then if you do take hot water bath, it will be more effective. But even a normal, simple hot water bath will be very, very useful.
Doctor, can I speak to you?
Yes, please.
This is Dr. Jayakumar.
Namaste, sir.
Good evening. I was attending your program. It was a very informative and interesting and very good actually. But I would like to share with you one small thing which is not relevant to today's program or any program.
Okay.
Because you are interested so much in the natural things, I just wanted to. I recently come across one particular thing. I just want to share with you.
Yes,
it
sir.
may be of any use or may not be any use. There is a place called Coimbatore in Tamil Nadu. Can you hear me, Doctor?
Yeah, I can hear you clearly, very clearly, sir.
Yeah, Coimbatore is a very famous place.
Yeah, that particular place, there is one hotel they started. That hotel, they make everything. There is no fire, no oil.
Okay.
They are not using any stove or any such thing. And they are not using even a single drop of oil. They give all kind of foods what is available today in our house or in the market. I just want to share with you.
Oh, so you mean to say they will not cook? They will just give natural food as
no cooking at all. No cooking at all.
Great. So
they're really something new. I thought I
wonderful.
Can pass
Yeah, thank you for sharing this information. It's quite interesting.
Even the milk, they are not using the regular milk. They are using some coconut milk. They are making curd out of that.
Yes. Many people use this. Vegans, particularly, they make different kinds of nut milks and milk out of this groundnut seeds. That is very good to make curd. Actually, I have eaten it. It's very tasty.
Yeah, curd they are making out of the coconut milk and everything. They are just the natural things they are making use of it. Even the packing they are using all natural things.
Yeah, it's very good. Actually, we should visit such place.
No plastic is used. In a systematic way, they do it, and everything is.
Which place in Coimbatore?
It is in Coimbatore, in Tamil Nadu.
In Coimbatore, which place? Like any?
It is very near to Pelamedu.
Okay, great.
There's a place called Singanallur.
Oh, great.
It is. They are making it. It is really some good informative thing.
Yes.
I thought I can.
Thank you so much for sharing this, sir. It's a really useful thing.
Feel like you can give me your WhatsApp thing. I can pass it on to you.
I don't use WhatsApp, but I have just now I have typed my email ID, drsundarrajperumal@gmail.com.
Yeah, but the thing is, he gives a talk in Tamil. I don't know how far you can able to grasp anything from the.
My manager is a Tamilian. I think we will be able to manage.
Okay, I will do one thing. I will pass it on the message to you. I am sorry, I am taking your time because there are so many people maybe waiting.
Yeah, Mr. Chandrasekhar is asking, Parijata leaves juice for back pain or spinal problem. Actually, Parijata leaves decoction is clearly very effective, and it was the reference is there in ancient Ayurveda books that Parijata leaves decoction is very, very good for spinal cord to reduce back pain and neck pain and other pains due to Vata disorders. So we have, many people might be knowing about this Parijata tree. The leaves are very thick and rough in texture. So they are very good in reducing pain actually. And even in Patanjali, we have this Parijata Kvada Churna, which is very cheap. Maybe 100 grams is 10 rupees or 15 rupees.
Yeah, Dr. Sundaraj, I wish I would have attended your session right from the beginning itself. In fact, about 10 days back only, I got a pain in my back. I have been getting it, say once in 2-3 years or something, the lower portion of the back.
Yes.
And obviously, then immediately kind of, reporting to the doctor, then some physiotherapy. Of course, not this time. I could not go for the physiotherapy because obviously I'm not going to the doctor because of this corona thing. So I had to consult some known doctor, orthopedist, and obviously he recommended ultra set for 2 days, morning, evening. I did get relief applying Volini also, but obviously maybe it is not a permanent thing. So what do you advise me? I'm 75 years old.
Sir, best thing to strengthen your back is to apply oil to your body every day before bath. If you can apply some good oils like Mahanarayan Tail or Balashwagandha Tail, that is very, very good. If you have severe pain, immediately the pain relief also will happen just by taking bath, with the oil massage and hot water bath. But even simple plain til oil, plain sesame oil also will help in strengthening your back. Of course, practicing simple asanas like Bhujangasana and Shalabhasana, only two.
Yeah. That is important. I believe.
Yes.
Asana, which you mentioned.
Yes.
This 3 years back when I had gone for a physiotherapy friend, I was advised
Yes.
to use Bhujangasana and all those things. So what happens is lifestyle, you
Yes.
practice for 2 days and you forget about it, unfortunately. That's the problem. So I think that is very good. When I heard you talking about Bhujangasana
Yes.
and giving all those pictures, it was very good. It's very useful, I believe.
And also pranayama and meditation, they are also very, very effective.
I see.
Regeneration of the skeletal system will
Oh, I
happen.
see.
Mhm.